How are you doing, YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be going over the benefits of exercise for patients with diabetes. Now, before starting any exercise program, please make sure to get clearance from your family physician. Now, let's start off by describing what diabetes is. So we know that there's two types of diabetes. There's type 1 and there's type 2. Type 1 diabetes is essentially when your body is not able to produce enough insulin, and insulin is necessary in order to get blood sugar or glucose from your bloodstream into the cells where it needs to be used. Now we know glucose, its main function is to provide energy to the body, and without insulin we're not actually going to be able to get these molecules of glucose into the cells to be used. And so insulin is very vital, and with type 1 diabetics, insulin injections are needed. Now with type 2 diabetes, or the more common form of diabetes, we have an insensitivity to insulin. So what happens here is your body does produce insulin, but it's not as sensitive to insulin. So when insulin binds to receptors of your cells, it takes a lot more insulin to actually be able to get that sugar from the bloodstream into the cell. And this insensitivity to insulin happens essentially due to the Western diet, overconsumption of carbohydrates, simple carbohydrates, sugary drinks, candy. And over time, by consuming these types of foods, you're going to build up this insensitivity to insulin, which evidently will lead to type 2 diabetes and potentially for you to have to go on medication. Now, what does exercise come into this? Well, with exercise, we know that glucose is going to be used for energy. And so your muscles actually store this glucose as glycogen. Now, when you exercise, your body taps into that fuel source of glycogen immediately to the working muscle. So if you're running, your body is going to tap into the glycogen stores in your legs to use that as energy. If you're doing exercise, strength training, upper body workouts, your body is going to tap into those muscles, the chest, the arms, the back, the core, for those immediate supply of glucose, which is being stored as glycogen within your cells. And so your body is able to rapidly use that in order to perform the exercise. Now, post-exercise, what ends up happening is your body needs to replenish these stores. And so from the foods that you consume, naturally these glucose molecules are going to be diverted into your muscles to be stored for later use. And so the main thing I prescribe to patients with diabetes or even borderline diabetics is to be performing some sort of resistance training, because we know that diabetes is an issue with too much blood sugar or glucose floating around in your bloodstream. And we know that having this occur for too long of a time can lead to many issues, including renal issues. It can lead to issues within the eye. It can lead to issues within the heart, increase your likelihood of developing heart disease. And so we want to do what we can to bring these sugar levels down. Yes, medication is an option, but as many people are aware, if you can do this from a lifestyle standpoint, then absolutely you want to be trying that avenue first. And so by performing regular exercise, 150 minutes of moderate aerobic exercise a week, we're going to be able to significantly reduce this blood sugar level. And by also performing resistance training weekly, at least 2 times a week, training the major muscles of the body, you're going to be able to, again, tap into those glycogen stores within the muscle and use that as fuel for your workouts. And so once you finish the workouts, these effects do last post-workout. And so you're able to actually regulate your sugar levels even, post-workout throughout the day. And so why is this important? Well, the more exercise we can practice throughout the week, both aerobic exercise and strength training, the better you're going to be able to regulate that sugar level, and hopefully, potentially coming off medications down the road, or going from a pre-diabetic level to not having diabetes, or even reversing type 2 diabetes, right? Going from being a diabetic, practicing good lifestyle habits, obviously eating the right foods, exercising, losing weight, to potentially reverse that type 2 diabetes, so you can come off of your medication completely. Now, when it comes to medication, obviously you don't want to just stop them on your own. There's a reason you're taking these. And for you, if you're dealing with significant diabetes, with significant levels of blood sugar floating around in your bloodstream, you do want to be taking these medications. Now, one thing to keep in mind, especially if you are going to be exercising on while taking diabetes medications, is having your blood sugar levels drop too low, because we know that exercise is going to be using glucose from your blood to supply your working muscles, so that's going to drop your blood sugar levels. And if you're on medication that also drops blood sugar levels, you may run into the risk of hypoglycemia post-exercise, or too low of blood sugar. And symptoms of this may include some dizziness, hunger, a little bit of lightheadedness. And so it's very important, especially if you are a patient that is diabetic and taking some of these medications, insulin, metformin, some sort of SGLT2 inhibitor like empagliflozin, dapagliflozin, to make sure that you have a snack handy, so that post-exercise, if you do find that your sugar levels are dropping too low, you have something to eat to bring those sugar levels back up. And in the clinic, we do encourage our patients to have a snack with them post-exercise. So if they do have any of these symptoms, they're able to consume that snack and bring those blood sugar levels back up. All right, so if you found this video helpful, please give it a thumbs up and share it. Let me know which types of videos you would like to see in the future. Once again, my name is Nick Pratap from Next Gen Rehabilitation. We'll see you in the next video.